Nursing is the first program here in Luzerne County that's offered from Misericordia. That's dating back to 1924. So we have a long time history here. So I am biased when I say come to nursing school at Misericordia because we've been here the longest and we've had lots of success with our program. So nursing right now is in the forefront of every part of healthcare that we see, and they make up the largest component of the healthcare industry. So nurses are needed, they're in the community, and they're needed with their expertise. The great part about nursing is that you can branch out. You can go to different parts of nursing. So there's home health once you're graduated. You can go to home health, you can go into clinics, you can go into bedside nursing, and you can also complete that with a graduate degree here too. So you can bridge over and go into the graduate programs and become an advanced practice nurse. Misericordia is like that home-like feeling. So it's where you want to come to when you feel, I guess you could say, nurtured. So we have our 4 charisms that we use when we approach students and we educate students. So we have mercy, service, justice, and hospitality. So all 4 of those are what really support what we do as a faculty member and our clinical faculty and all of our staff here. So we feel that we give those 4 charisms in every day of teaching, of every day of communicating with students, and I feel that that is a draw for students and they feel like they are nurtured and they're cared for. We also do have a success of our graduates going out to our own community. So they go into local hospitals. So we do value the fact that our students are graduates and then they go into the Luzerne County area. Our undergraduate programs that we have at Misericordia include the undergraduate traditional program, which is the typical senior student that would apply from their high school into college. Then we also have an evening program, a part-time evening program for those that are working adults. They have other careers, but they would like to select nursing, and that's an evening type of program that's here on campus in Dallas. And then we also have a new program that's in Pittsburgh, and that's our accelerated BSN program. That is a 1-year, 4-semester program that is very accelerated, but it does offer flexibility for those that want to just take a little time off from their schedule, be a nurse in 1 year if they've completed a prior baccalaureate degree. So they have a BSN, or they have a bachelor's degree in another field, and then they can go into nursing. So that's a very rigorous program, but full-time, and it is one of our newest programs that has been successful so far as well. So we opened up that campus last fall, 2019, and we've had cohorts come in at 3 points throughout the year. A lot of the sciences are what preps students to become a nurse. So the science courses in high school, a lot of students that have an interest in healthcare, obviously that's where you'd want to be. Also personality, lots of good communication skills, being out there in the community, showing that you're having a caring personality versus those that may not be so interested in any healthcare. Of course, there's a lot more to that than just the caring traits. You will be seeing a lot more in clinical, you'll be seeing a lot more in the OR, in clinical experiences, patients that are extremely sick versus those that need some maintenance of care. So there's a lot of variation in what you might see, but the interest needs to be with patients and be interactive. Undergraduate nursing has changed in a way that we have had face-to-face format and then moved to online, especially in the past year. We've moved towards more clinical experiences, more community experiences, so it has shifted with the paradigm in healthcare in today's society, so a lot of changes. So the first year and the freshman year, they would take core classes. So part of the core is what's offered from our curriculum here at Misericordia University. So those would be sciences, math, history, religion courses that have the degree offered from Misericordia University. Then second year in their spring semester, they would go into clinicals and start as early as their second year. Third and fourth year, they are in the hospitals with every clinical course every semester. So they're in it in the last 2 years to be prepared to be out in the nursing force by the time of graduation. So our clinical affiliates are here within northeastern Pennsylvania. The majority of them are within Wilkes-Barre, so we do have Geisinger affiliates, we do have Wilkes-Barre General affiliates, we have psychiatric hospitals that we work with for those rotations. We also have some clinics that are specialty clinics for pediatrics. So all of the specialties are here, and they do remain in northeastern Pennsylvania. The National Council of State Boards of Nursing for all states for nursing licensure offers the NCLEX. The NCLEX is an exam that all nursing students would take at the completion of their school. So that is a test that allows the nursing student to become a registered nurse and then practice within the hospital system or wherever they choose to practice. But that licensure exam is the exam that we hold our bar to, so that we have that pass rate at a rate where we know we're safe to allow students to go out and practice, and that's of course set by all state boards. Specialties are always important to have as part of the curriculum, but students do not come out of nursing school with a specialty. So all of the nursing students graduate, they take what we call the NCLEX exam, and they are prepared to take that in all areas of nursing. So pediatrics, psychiatric nursing, med-surg nursing, some critical care nursing. So they can branch out into any of those once they graduate, but they're prepared to be able to sit for the NCLEX with all of that preparation.